I'm Dr. Brian Mustansky, and I'm an associate professor in the Department of Medical Social Sciences at Northwestern University. Suicide risk is a major public health concern in the United States. In fact, it's the third leading cause of death amongst adolescents. Prior research had suggested that LGBT or lesbian, gay, bisexual, and transgender youth were more likely to report having made a suicide attempt. Data for the study came from Project Q2, which is the longest-running longitudinal study of LGBT adolescents. We started the project in 2007, and it's still ongoing. We bring the youth back in for assessments and interviews about every 6 months. We recruited the sample using a social network-driven approach, which means we found a small group of youth using flyers and community outreach, and we asked them to recruit their friends into the study. And over successive waves of peer recruitment, we were able to get our sample of 246 youth to participate.
The population sample for this study is very diverse in terms of race, class, education level, as well as housing status.
Most of the studies in this area had been cross-sectional, which gives us an idea or a snapshot of differences, health disparities, or differences in terms of risk behaviors, but really don't let us understand what predicts whether a youth will engage in suicide. When the youth first came into the study, they completed a set of baseline measures, which included a structured psychiatric interview measuring their past history of suicide attempt behaviors, as well as some questionnaires that measured things like gender nonconformity and some personality characteristics like impulsivity and sensation seeking. Then, each time when they returned for a study visit about every 6 months, we collected additional questionnaires about self-harm behaviors, about experiences of victimization, and social support from family and peers. We hypothesized that there would be both LGBT-specific risk and protective factors like experiences of victimization, as well as factors that are general to all adolescents that we included in our study.
The study is a very powerful study, allowing us definitely to respond to an epidemic in this country around bullying, which has existed, but now with research and studies such as this, it can really be put in the spotlight.
These findings really highlight the importance of addressing victimization and bullying of LGBT youth. LGBT victimization, meaning somebody physically assaulted the youth or verbally assaulted them because of their sexual orientation, increased the likelihood that the youth would have thoughts of suicide. And we found that, on average, each episode of LGBT victimization increased the rate of self-harm behaviors by 2.5 times.
When LGBT young people are victimized, they're at higher risk for suicidality and self-harm. And when they're supported, that risk goes way down.
There's things like safe schools programs and gay-straight alliances in high schools and middle schools that can make youth feel more supportive and reduce bullying throughout the school.
Their experience of people bullying them impacts their well-being. And the more we are able to engage the community at large and their allies and friends to step forward and to be educated, it will help a more healthier community. It will help the individual that has been bullied to live a much more healthy life.
For more information about these issues, I encourage you to visit the website of the Northwestern LGBT Health and Development Program at impactprogram.org. Other great resources include the website of the Trevor Project, PFLAG, and the Gay, Lesbian, Straight Education Network.